Welcome to Dr. Balga's podcast for the Curious Doc. Today is January 29th, 2026. This video is an article published in the Lancet on January 24, 2026, titled Deaths Potentially Avoided by Small Changes in Physical Activity and Sedentary Time, an individual participant data meta-analysis of prospective cohort studies. There is an accompanying commentary titled Quantifying the Public Health Impact of Physical Activity. Population-level mortality benefits of small realistic changes in activity and sitting are uncertain. Prior estimates often use self-report and dichotomous thresholds. Study design, individual participant data meta-analysis of prospective cohorts with device-measured activity and sedentary time. The UK Biobank data was analyzed separately. Sample 7 cohorts from Norway, Sweden, USA, 40,000 to 327 individuals with 4,895 deaths. UK Biobank, there were 94,719 with 3,487 deaths. Participants were above the age of 40. Deaths in the first 2 years were excluded to reduce reverse causation. Follow-up. Overall pool data set described as a mean of 8.2 years. Cohort follow-up ranged roughly from 3.8 to 14.3 years per study. Exposure, moderate to vigorous physical activity, and sedentary time minutes per day from accelerometers. Incremental scenarios, plus 5, plus 10 minutes per day of moderate to vigorous physical activity. And for sedentary time, minus 30, minus 60 minutes per day sedentary time. Statistics Cox proportional hazards with non-linear dose response, fully adjusted for comorbidities. The effects were summarized as potential impact fractions. What did they find? Large risk reductions occur at low end of moderate to vigorous physical activity. Example, an increase by 5 minutes per day, that is from 1 to 6 minutes per day, was associated with 30% lower mortality risk. The benefits plateaued beyond 24 minutes a day of moderate to vigorous physical activity. Population impact. High risk were least active, about 20%. Increments of 5 minutes per day of moderate to vigorous physical activity could avert 6% of the deaths. Population based, all except most active, was about 20%. Sedentary time, reducing sedentary time by 30 minutes per day, 3% of the deaths were averted in high risk versus 7.3% in population-based. Little association below 480 minutes per day of sitting, stronger above that. The UK Biobank, effects were smaller but meaningful. Example, about a decrease in 30 minutes per day of sedentary time in all except most active was associated with a 4.5% of the deaths prevented. Limitations of study, observational design, assumptions about feasibility and capability to increase activity, accelerometer calibration and processing differences, notably for moderate to vigorous physical activity, affects the magnitude, weaker associations in adults below the age of 60 due to limited events. The UK Biobank device placement also differs. Key takeaways for population health: 5 minutes more of moderate to physical activity and 30 minutes less of sedentary time could plausibly shift mortality at scale, especially by targeting the least active and the most sedentary. Commentary. Why this study matters? First, to quantify deaths averted from moderate changes in sedentary time plus light and moderate to vigorous physical activity using accelerometer-based measures across multiple cohorts. Headline numbers: population approach. Increasing moderate to vigorous physical activity by 10 minutes per day is associated with 14.9% decrease in deaths. Decreasing sedentary time by 30 minutes per day is associated with 7.3% of the deaths being decreased. Increasing light to intensity activity by 30 minutes per day is associated with a 5.4% decrease in deaths. Increasing total activity by greater than 30 minutes per day is associated with a 6.1% decrease in deaths. Strength of the study: harmonized device data across geographically diverse cohort, improves precision of dose response curves, and extends the impact estimates beyond moderate to vigorous physical activity alone. Caution: magnitude for moderate to vigorous physical activity depends on assumptions. Excluding adults with mobility limitations reduce deaths averted by 15 to 20%. Moderate to vigorous physical activity measurement methods lack consensus and can materially change estimates. The bottom line: public health wins may come from tiny nudges. Small hinges swing big doors, but only if the hinges can move. Clinical pearls. Pearl number 1: prescribe the minimum viable dose. Add 5 minutes per day of brisk exercise for the least active. This is where the curve is the steepest. Pearl number 2: for highly sedentary patients, that is sitting greater than 8 hours per day, a 30-minute per day sitting reduction spread across the day is a realistic and actionable target. Pearl number 3: device data outperform recall. Step counts and accelerometer time can anchor behavior and feedback loops. Pearl number 4: frame it as substitution. More moderate to vigorous physical activity often displaces some combination of sitting and light activity. Small reallocations compound. Pearl number 5: in older adults or those with limitations, tailor intensity. Light intensity movement and breaking up sitting remain valuable, but capability assumptions matter. These are some eponyms related to this study. Hit pause and read at your leisure. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.